Gusa!
Oh,
That's the home run, baby.
Welcome to the office.
Welcome to the office, Das. How can I help you?
Doc, I don't know, man. It's I have a laundry list of issues.
Okay.
And
Where are you coming from?
From New Jersey.
New Jersey.
Jersey City.
Okay. Cool.
Laundry list of issues that I'm not expecting any miracles, but
I am.
I know you're very experienced, and I came all this way because the Gonstead method seems to be helping a lot of people that have similar issues to what I've been having.
Okay.
And I think the general idea is that I don't really feel like myself. I got injured a few years back, and from that moment I had pretty severe cognitive decline and physical decline.
What was the trauma?
So I was living in Long Island, and I sold everything and did the whole backpacking India thing.
Okay.
And about 3 years in, after I felt like I had put a lot of effort into like studying and increasing my intelligence and just focusing on that aspect of my life, I said, you know what, let me do some MMA. So I went to MMA trial class, and probably like the second or third session, and the instructor said, like, let's pair off into sparring partners. And I was the odd man out, and so we sparred. And I must have thrown a punch that was a little bit too hard, and he thought I knew what I was doing, so he roundhouse kicked me in the head. And
Left side or right side?
he came in like this.
So he got you from your left.
Yeah. So he
Okay.
he did break my nose, and I didn't black out or anything, but it was from that moment specifically that things started to get really bad.
Got it.
Yeah.
And this was when? 5 years?
2017.
Okay. It's about 7 years ago.
Correct.
Prior to that, you didn't have any of these issues?
The only issue, which was a minor annoyance, was I always felt like my left knee was hurting, and like my left socket, hip socket, was a little aggravated.
Okay.
But and ankle. But other than that, nothing as major as this. No.
Got it. Okay. So what are the major issues right now? Where are we right now? Back, hip.
Yeah. I'd say the lower back is the main issue right now.
What's the issue?
Just very restricted movement.
Okay.
And even just 2 days ago.
Which movement is restricted? Back, forward, side, twist?
I would say,
No,
squatting, balance, we'll say forwards and backwards.
So flexion and extension is limited.
Yes.
And are you working right now?
Yes.
Are you sitting or standing more?
I'm doing a lot of physical activity. I'd say 80% of it is sitting, though.
Okay. All right. Okay. So low back, localized, shooting down your leg, right side, left side.
I'd say there's some shooting down the left side, but mostly just localized to the lower back.
Localized. Okay. What else?
This is kind of out there, but like in terms of my ability to think on my feet and really process things quickly, that has like really changed. I think that the way my brain is communicating with my body is just not working the way that it has before.
Have you seen a neurologist to make sure nothing's going on up
Yes.
there? You've had MRIs done after those injuries.
Nothing that came up in the
They
MRI.
can't find any physical thing up there that
Mm-mm.
could be causing this.
Mm,
All right, it's
that's
good
my
news.
knowledge.
It's good news.
Yeah,
I just
yeah.
want to make sure we rule that out.
For sure.
Then I can go for
Yeah,
it.
not to my
Then
knowledge.
I go for it. Okay, all right.
Please go for it.
Okay, so cognitive ability, processing.
Mhm. Verbal
Um,
fluidity, memory, things like that were very heavily affected. For example, I used to read like 5 nonfiction books a week, and that was like my thing. And now I can't do that. My eyes don't even when I try to move along a page, it's like they micro stutter.
All right, let's take a look and see something. Just follow your point. Don't move your head, just move your eyes. So let's check the range of motion and let's see if we have any nystagmus. Up, down. over, down, over. Little nystagmus. What's it doing to you right
It's
there?
like, it's sending like, almost like a mild shooting pain like down my back. It's not pain, but it's just
A shock.
Yeah,
shock.
something like that.
Okay, follow. Not as bad, but a little bit. He doesn't like to do that.
Yeah,
He's
clearly.
catching himself. Have they tested your eyes before?
Yeah, and they said, oh, it's fine.
Let's check for convergence. Watch his eyes, Shasha. The right one goes in more than the left one goes in more than the right. Let's try that again. Got it. Now it's going down. Okay, that's all right. These are good tests for us to look at later. So I'm looking for convergence. This eye converges in more than this eye. It's a little lazy on that side. We go all the way this way. We go all the way that way. So that right eye isn't performing the same as the left. Okay, and convergence. Converge, converge, converge. Good. Okay, we got some work to do, brother. All right, that's number 2. What's number 3?
Probably just digestion. I feel, I guess it has something to do with the digestion, is that the fact that right before my injury, it was very easy for me to build muscle and lose weight. And immediately after that, it became very difficult. It's almost as if my body is stuck in like a fight or flight mode. And I don't know if that's specifically what that would be, but it just feels like my body is not relaxing.
You're stressed all the time?
Yeah.
Yeah, you thinking too much?
I mean, I always think.
Right, okay. All right, and you can read a lot, right?
Sure.
So you could probably read a book in a day,
Yeah, absolutely.
right? If the eyes are feeling better, and all right, let's see if we can get that and make that happen before you leave, dude.
Sounds
That'd be
good.
kind of cool. All right.
That'd be awesome.
All right, dude. Okay, so that's where we have to start.
Okay.
You're here 2 weeks, so we got a little journey. Guys, you want to watch this journey? See what happens? All right.
Ready.
Jokes aside, let's go over your x-rays.
Sure.
Let me tell you what I see, because I think that's what you're really looking for.
Yes, sir.
In your answers.
Yes, sir.
After that, we'll examine you, figure out where we're going to start.
Okay.
You ready to let it go?
Yes, I am.
All right, dude. All right, Das, this is you. This is a picture in time.
Okay.
Tells us how you've evolved from birth. 24 bones in the spine that move, 23 discs in between. This is your back profile, looking at you from behind. That's the right side, there and there. This is your side profile. On your side profile, we're looking at a few things. Do we have the right curves, number 1? And number 2, do we have the right posture? And number 3, how are the discs?
Sure.
So the first thing is the posture, and let's look at it. We're going to run a posture line from L5, the lowest lumbar. You've watched my videos, so you kind of know what's happening. You can see your upper body behind your foundation, and as a result, those muscles are working overtime way too much.
Oh, yeah.
Okay. Second thing before I continue here is I want you to see there is a little bit of disconnect here. And that's probably where you're getting pops and cracks. Instability. You can crack
Definitely
your neck.
instability.
You
for
can
sure.
crack. You can crack easy, right?
Yeah.
Yourself, meaning.
Yeah.
Okay. So we'll look at that in more detail.
Okay.
So number 1 is posture. Result of this is these muscles and ligaments are working overtime just to hold you upright. Okay. Now for the discs, I'm going to come back to the discs because overall the discs are pretty good.
Okay. That's good news.
Yeah, you know, there's actually, you know what, I'm going to do it. But I can see we have an old tailbone injury to deal with. You're 5, 4, 3, 2, 1, 12. Overall, your disc spaces are decent, okay? I had to shoot through that area pretty good. Your disc spaces are decent. I would like to see them more parallel, not tilted. And I would like to see a better, like this curve is good till about here. But then you kick back a little too much here, and you're almost like on my motorcycle riders. You be flossing on a Harley?
I do spend a lot of time on a bicycle.
Okay. Well,
But
we need to change the posture.
Sure.
Okay.
Sure.
And it may feel a little weird in the beginning, but again, all these discs are good. I cannot see in this area. We will talk about it here, okay?
Sure.
When we get to the neck, we have a little bit of the reverse, and then you have the normal curve, and then a little bit reverse again. So again, instability. We will come back to that in more detail. Let's take a look at this x-ray. In order to have a stable building, we need a level base and foundation. Do we have a level base and foundation? No, we do not. Let's look at the foundation. What do we got? We have a short leg on the left, rotated pelvis, rotated sacrum, classic ASIN with a rotated sacrum on the left side. Now, here's the interesting thing. Okay, this is good for young doctors and Gonstead guys and students to learn too. The book says, page 43 of the chapters, when you have a rotated sacrum on the side of an ASIN, AS or IN major, the book says to do the sacrum. Okay. I would agree, most likely in your case too, and here's where it confirms on the x-ray. Right now you have a 4 millimeter measured difference. If I adjust your pelvis, I will make it worse. So the answer is not your pelvis. So the answer is here in your tailbone, rotated sacrum, drop 3 millimeters, which is contributing to the 4 of that. So this is all tailbone. This is all tailbone. We got to bring that side up. Now, from there, I want you to see. So that's our answer there. However, here's the challenge. You got a coccyx bent the opposite way.
Ooh,
so I got to do coccyx right, sacrum left.
Interesting.
Yes, and here's where I saw it. I mean, check it out right there. So when I'm looking at the overall tailbone, I can see it actually bends. It should curve this way.
Okay.
So the fact that you put a lot of stress on it, I know you lifted heavy back in the day. I'm pretty sure you did some heavy stuff.
I was extremely physical when I was young.
Got it. But let's look
including
here.
Lifting weights. Yeah.
One, here's where I see the disconnect. And this is where I would start, okay? Sacrum and coccyx. Now, let's work our way back up again, please. We said these discs are good. They're tilting. Tells us compensation. Okay, we're not... You see how we can see the end plates nice and clear here?
Yes.
Here we see these circle patterns. It's because of the tilting of the vertebrae.
Okay.
So when I'm seeing that here, I'm kind of suspecting it's a compensation lower down.
Okay.
That's how I see it. Not everybody sees it that way. That's how I see it. And that's okay.
I trust you.
Now, let's continue. That slight short leg and drop sacrum creates this curve in your lumbar spine. The answer is not here in your lumbar spine. This is all compensation. You have a lumbar rotatory curve due to your tailbone. Now, digestion, before I go up, all of this is undigested food. You got a bunch of FIPS.
That's wild.
Farts in progress. Here's the Megan Blasi. We will need to work on your digestion while you're here. I do also want you to get your thyroid checked when you get back.
Okay.
You have what's called flailing of the ribs. I talk about it from the beginning of all my videos. When I see this, this is a finding I was taught. I'm about 90% accurate with it. And we need to check the thyroid to rule out that there's no imbalanced thyroid or even the parathyroid.
Okay.
Okay, calcium regulation is controlled by thyroid, parathyroid. Again, I've talked a lot about this in the past. The main thing is let's just rule it out, make sure there's no underlying thyroid issue. All right, now the fun starts. Now we go up. Look, straight, straight, straight. What the heck happened there, dude? Now here's the interesting part. No, you got it stuck good, dude. So let's look at the pedicles. Here's the answer, okay? So let's look at these circles here. See those circles?
I see them.
Yeah? Let's change it a little bit. Better?
Sure.
Okay. Circle, circle. Bigger, smaller. Smaller, bigger.
Whoa.
Smaller, bigger. Switches. Smaller, bigger. You follow me?
Yeah.
Look, smaller, bigger, smaller, bigger, smaller, bigger. So the answer is not there. The answer is down here, dog.
Okay.
All right, let me find it. There it is. T11.
Wow.
It's coming from there. Doo-doo. It starts there. He's like, yeah. Maybe 12, let's see. This takes a lot of time. People don't do this.
I've seen
Watch
quite
this.
a few chiropractors.
Watch this.
Yeah.
This is 12, right? Or sorry, let's make sure where we're at. 5, 4, 3, 2. This is 1. 1 is level. You see how? You see how subtle that is?
Yep.
It's T12. T12 is causing all his neck stuff and upper back. All of this is T12 compensation. Now, let's change the factors up. Let's go to the upper cervical.
One thing I didn't mention earlier is that when I lay down, and this happened immediately after my injury, is I feel like a throbbing in my neck.
Yeah, we're getting there.
Okay.
I'm going to get there right now.
Like almost like a rushing of blood sound.
Yes, sir. Now, here's the other part. So, from 12, the whole thing is curving this way. Then it's compensating. C2 is wedged on the right. This is all compensation, dude. It's not going to fix anything. You have a big swollen disc right here, but it's compensating. It's not the answer. It's not the answer. Are we having fun yet? All right, so here's what I see, dude. I see that we have this T12 for show. We have T12, we have tailbone, and we have potential upper cervical. Right atlas is a potential, but right atlas won't hold without 12 in the sacrum.
Okay.
So that's what I see there. Make sense?
Yes, sir.
You ready to get started?
Yes, sir, I am.
And as we go through this journey with you, Das, I will be going over more details and more education for these guys as well.
Sure thing.
I get a lot of comments like you need to start teaching people and
I mean, you already do.
At least I can start putting out more information for people to look at, right?
Absolutely.
And the one advice I have for everybody out there, doctors and students, you know, they say work hard and practice, practice. Practice makes perfect. No, perfect practice makes perfect. And there's really no perfect practice. It's just you got to keep studying. And my daughter asked me the other day, Rumi, this was actually we were driving yesterday. We were talking about school and how much work is involved. It was just yesterday in the car. You remember Rumi? And I said, you know, Dad used to go to school. I'm talking about chiropractic, and even undergrad. And I put in 5-6 hours of book work every single day. But then that was undergrad. That was science. That was fun for me and my group. When we got into chiropractic, I was very fortunate that a lot of the science, I already had that background. But I still had to put in 4 hours a day of books, and then 3 to 4 hours a day of hands-on drills, x-rays, everything.
Right.
Vacation time, I'm seeing people. I'm working. I'm doing the work. I'm trying to get myself better. And someone asked me, like, you know, what was different? And I'm going to share one more story real quick. The story was, what's so hard about Gonstead? And why do people give up? Doing Gonstead is a system. And you're looking at the whole system. It doesn't mean I'm just doing a Gonstead style low back adjustment. To get to the offending vertebrae, you have to go through the system. You don't just figure it out one way, okay, I'm going to do it this way. There's a whole system that we follow, right? Protocol.
Sure.
And I was very lucky in third semester. I got the first cervical adjustment. I got a C3, and it was so clean. At least that's what I thought, and I think it was. And guess who it was on? It was on my mom. And that, she goes to me, Rahim, that felt like the doctor I go to. That was pretty good. I was like, shit, really? She was like, yeah, really. I'm like, okay. And then she comes back home that day, and she's like, she repeated herself. you do this work, Rahim, or you don't do chiropractic. So my mom, as a lot of people knew her, was no bullshit, very practical, helped a lot of people in the way she did, and she's like, you do this work. So that's why I do this work. Okay? Got it? Ready to get started?
Yes, sir.
Let's see the walk. Oof. Let's see if you got the Bombay wiggle.
So just like 2 days ago, I
Come on, stand over
back
here.
out. So I'm hurting.
I got you, don't worry. You're gonna walk to the corner of the room and back.
Sure.
Let's see, we wanna see, do the dimples move? How is his presentation? He's a big guy, dude. Lifts a lot of weight. Or did. Inflammation, swelling right here. This is all inflammation.
Yes.
This is all swelling. Walk, please. You walking with that Jersey swang.
That's how I know.
That's that Jersey swang.
That's how I know.
I gotta give you some LA swag on this trip, dude. All right. Well, he's got a little extra swag because he's got a lot of imbalance. And this is not because he wants to walk like this, it's because that's the most comfortable at the moment. Right?
It's been for a while, yeah.
Walk a little faster, please, so I can see. Yeah, he got that Jersey wiggle. Come on over. Have a seat.
Let's get started.
All right, sir. Let's see what we got. Starting at the base of the neck. First thing we're getting, 15, 17 points. Left side. It looks like it's going to break, but it doesn't. Need to check it out. And it's top right. It looks like it was going to break there. See one right. Now we gotta play through some of this inflammation. Bear with me.
Sure.
There you go. Mm-hmm. There. Now what's going to be interesting here when you see this, there, 12-1, T12L1, and S5. S5, T12L1, C1. Those are your three majors I'm getting today, dude. And you ready to start peeling this onion? Head
Yes.
down, please. Round your back. Best you can. All right, let's do static. Static palpation. He has dishing of the spine here. The dishing usually starts at 7 in the body. Plogger's book talks about it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 11. Round your back for me, sir. There we go. Right there. Yes?
Yes, sir.
That's 11. That's 12.
Yep.
Yes?
Yeah. Yeah.
T12. L5. S1. S2, S3, S4, going down low, brother, right there.
Yeah. It's almost like it doesn't move.
Yeah, but they say the sacrum is a fused bone, it doesn't move. S5, T12. Let's check up top, sir. Sit back for me, please. 6, 5, 4, 3, 2, 1. All right, dude. Here's our game plan for today. I'm going to start on the foundation, of course.
Okay.
We're going to do coccyx First on the side, sacrum over here. Have you walk, then we're gonna go do T12 on the knee chest table.
Sounds
Have you walk again, then see if we actually need to touch the neck today or not.
Okay.
After that, I will work on your ankles today. Shoulders, elbows, wrists. We're not touching knees today. Nose, we're gonna wait one visit, okay?
Yes, sir.
All right, we have a little bit of time. That may be a juicy one. Stay and walk it out. I'm just messing with you.
It was broken, so
just
yeah,
messing.
we'll
I
see
mean-
what we can do.
I'm one to make fun of noses, dude. Walk it off once, do it to the corner and back, and we get started. And you go left side down, please. Dude. Oh, showtime. I'll try this at home, guys. I'll be outside on your underwear,
Sure thing.
but I'm gonna be down low.
Okay.
Yes?
Sure.
Yes?
Yeah.
Do you feel that?
A little bit.
Let it roll. Roll. Let it roll. Gotcha. Come up slowly, please. Let's go face down. This guy don't even flinch. Let's go face down, please.
High pain tolerance.
You been to Thailand? What?
High pain tolerance. But I have, yes.
Slide up a little bit.
Great country.
Okay. I need help. Oh, you gotta hold the legs.
Yes,
All right.
okay.
No, no, no,
No?
no.
Alright.
Usually they hear me call Shasha. Today it's Ruby. Who are you? All right. You ready, sir?
Yes, sir.
Smooth it up. All right, brother. Whatever you need to let go of, you need to let go. You need to drop, brother. Drop. That's the home run. Thank you. Nice. Wait for it. Okay, and I'll have you walk it off, please. There you go. A little different, huh?
Yeah, I feel faster. Smoother.
Okay.
Where'd the wiggle go?
Where the what?
Where'd the wiggle go?
I don't know. Oh, where did the wiggle go? Let's bring that up a little bit. There you go. T12. Knees back a tad, please. There you go. Bend at the hip. Good. Chest down a tiny bit. Belly button down to the floor. Good. I know. Spicy? Spicy. You like your achar? Huh?
Yep.
You like achar?
Not really. But I do like spicy.
Alright, bringing the knees forward a tiny bit, please.
Sure.
There we go. Use the sale pickle. 5, 4, 3, 2. We gotta get all that tissue out of the way. You gotta drop that tummy for me, brother.
I'm trying.
All the way down.
Do I move my chest back a little bit?
Whatever
more?
you're comfortable with.
Try that. Is that better?
Is that good for you?
Yes.
Drop your belly button.
I'm trying.
There.
Oh.
That's the home run, baby.
Ooh, okay.
Yes, sir.
Ooh.
Wait for it. Come up slowly. That was crunchy.
Yeah, it was.
Don't stretch out your back.
Sure.
Hold
Okay.
my hand, please. Come on up.
Sure.
Don't round it off. Walk it off, please. That was nice. Kusa! Let it out. Walk 2-3 times, please. If I can open your back, please. Yeah. You got a little more movement in the dimples.
Nice.
Good. Keep going, dude. So your homework is walking, okay?
Sure.
Hiking. You're okay in the rain, right?
It's
You're okay with it.
yeah, of course.
Where you go to the mall. Keep going. One more time, please. And then let's recheck everything in the neck.
Okay.
Have a seat, please. A little different to sit.
Yeah, it just feels a little weird because I'm not used to it.
Got it. Let's see. Starting at the base. 12 is clear. Sacrum is clear. Okay. I ain't touching your neck. That's where I'm starting.
Okay.
That's clear. So, this is an interesting case. Foundation in 12. I will work on your feet. Go on your back here, please. Raise your leg.
Sure.
Raise your leg. AS talus, medial tilt. Sit up and turn, please. Let's go ahead and work on the shoulders. Sit back. Ears. Look straight. Drop the elbow. That was my knuckle. And now let's do the buff and polish. It's weird, right? I like
Yeah.
weird.
It'll take some getting used to. It almost feels like my muscles are like, hey, what is this? It's just not used to it. So
It's
the
gonna
mid
fight.
back is
It's gonna fight a little.
yeah, it is.
That's why the walking, right as soon as we're done, just go walk. And do me a favor, take that out for the next visit, the nose ring.
Okay.
Can it come out?
I don't think so, to be honest,
Well,
because
if you
it's
want me
a
to work on your nose, you gotta take it out.
okay.
Cool?
Yes. I'll figure it out.
Otherwise, it's gonna be a viral video. Stand up over here. Turn and face me.
Sure.
Step back one. Stand on your right leg. Raise your left leg. This is part of your homework. 2 minutes, eyes open.
Okay.
Proprioceptive work. You can start on this right away. Works the posterior columns of the spinal cord, and will help on G medius and the hip muscles.
Sure.
Other side, please. 2 minutes both sides. Once you can do 2 minutes both sides, you're going to do 2 minutes eyes closed. But don't worry about that right now. Okay? Let's check the hands. Hand put down. Squeeze slowly. Relax there. Lunate. Scaphoid. Lunate. Turn. See how it bounces back?
Yeah. I don't have great wrists. I've always had some grip problems for the last probably 10, 15 years.
Squeeze. Got it. Squeeze. Elbow. Lunate. A little more. That's where we're going to start, okay?
Yes.
Questions for today?
No. Thank you very much.
Welcome to the office.
Appreciate it.